Kansas City. This is Michael, and we're here today with Musadine Harold. Can you tell us a little bit about yourself and the store that you're representing?
Sure, yes. My name is Musadine Harold, and I'm with Blessed Health and Home Care. We are an in-home care agency and a home health agency in the greater Kansas City area here. And we also have a 24-hour care facilities, 10 beds, very small mini homes that we call it.
Well, Musadine, I met you at a recent Urban League meeting, and they were spotlighting you. Mm-hmm. Can you tell us what that was all about?
Well, yes. We've been working with the Urban League for the last couple of years, and we were identified as a candidate that we can grow our business here in Kansas City because of the type of business we do and the outreach that we do to engage other individuals and employ more people. So we were connected with the Urban League through a program called the Small Business 10,000 KSB program, which is national. And so we were one of the participants that were chosen to go and participate in this year-long process, and it had to do with a lot of education on entrepreneurship. Again, I'm a nurse by trade, and I have a business partner, Deborah Gardner. We're both nurses. And so when we started off, we had no business background. We wanted to do it because we care about people, and that's what our passion is at this present time, because we care, so we continue to do what we do for the community here. We predominantly work in the inner city, but we also have the outer core areas like Lee Summit, Grandview, that we work with individuals north of the river. So we have quite a bit of places that we touch people's lives, and so we're thankful we're able to do what we do. We help individuals stay in their homes a little longer versus going into a nursing home setting. So by providing in-home care services, they're able to continue to live at home as long as they can do a little bit for themselves. And so that's the joy we get out of it.
Well, it sounds like you do a lot for other people, but in this particular instance, you were being awarded yourself personally for your business. Yeah. And not only was it an award presented by the Urban League, but this was also Goldman Sachs sponsored.
Yes.
Can you tell us a little bit more about that program? Because this was a full year where you were sponsored, and you traveled. And can you give us a little bit more about the details of that fellowship program?
Okay. Yes, definitely. The Goldman Sachs program, again, is to try to get at least 10,000 businesses throughout the United States connected in terms of getting the information for entrepreneurship. So again, it was a long year program. We were connected with business mentors. We had to do online classes and then speak to our mentor every week and give an update. We had goals that we had to set, and then...
And what were some of your goals like?
Some of the goals, we had to look at our financials every so often, not monthly, but weekly. Oh. And so we had to, tell our mentor, we've been looking at the financials, and we had to learn how to read the financials in that terms. But again, just knowing to work on the business and not in the business, and that's one of their focus. We have to look at ourselves as business owners and not we're just worker bees. And that's a hard thing for us to adjust to, because again, I'm a nurse by trade. We're caring for people all the time, and so just working on our business and going through the program. Again, it was a paid free program. We got to go to Babson College in Massachusetts, and we had to go there twice for a whole week-long session, so it was really intense. The whole program was a day long.
How many people were there when you would go there?
150 candidates was chosen to go, but they have over 1,000 people apply every year. And so this is a program if anyone wants to do it. There is a criteria to meet in terms of the business aspect. You have to make so much to enter into the program. You have to be in business for 2 years at least.
Okay.
And so it's an opportunity to, dive in and learn this information, because again, we're not business majors.
So for someone who would want to apply for this program, they would need to be more than a startup,
yes,
but have some established business,
exactly,
so that they could see what they could do to improve that business.
Definitely.
Well, now that you and your partner have been through it, what do you think were the benefits that your business gained in particular?
Okay. One of the things that we are really actually putting in motion now is having a operational manual. Just knowing how to put things in place in terms of procedures, policies, and then follow through with that. And that's a challenge by itself. And even that's an up-to-date challenge to get follow through, getting procedures done, and then just everyone be on the same page.
This is for your employees?
That's for the business structure itself.
Okay.
Yeah, just structuring
And by the way,
business.
how many employees do you have?
We have about 50.
Okay.
Yes, ma'am.
Oh, so that's a handful.
Yeah.
Yeah.
It's a handful.
And so what were some of the other benefits or practices that you put into place?
One of the other things that I learned through this process was developing relationships, connecting, networking. And again, that's another challenge I'm still dealing with in terms of finding time to do networking versus just working in the business. And so one of my goals this year coming up is to try to get out into the community, to learn what's out there. Even just your program today, I'm just not aware of things. And so it's not being ignorant to the fact, it's just finding time to break loose.
Okay, well, I have to speak up for you because even though I introduced myself to you, you followed up.
Yeah.
And you after, I think maybe a week in between when we had last spoken with each other, you called me and you reminded me that we had set up an interview. So that I think that is something that you're doing.
Awesome.
And just keep it up because it does make a difference.
Awesome.
Yeah.
Yes.
Well, I think one thing that it sounds like your business is in a position to really impact the community. Are there any things that you want to see happen, particularly as far as your business and maybe how it can get others in the community to know more about what you're doing?
Definitely. One of our biggest challenges is trying to connect with the people that are, per se, have, I guess, money to pay for services. We're trying to see how do we reach those individuals. We, at this present time, service the Medicaid population, per se, because we're contracted through the Division of Health and Senior Services. So one of our biggest challenges is connecting with who can we get in touch with that knows the people that have finances to pay for our services. So the private pay sector.
I see. When what are some of the things that you'll be doing as far as getting in touch with those people? What kind of networking and other things do you think you'll be doing for that?
Yes, some of the things I've thought about for this coming up year is joining the Kansas City Chamber of Commerce. I understand there's a lot of nonprofit agencies that connect with those, and just try to see how can we get more plugged into these different individuals and know people. It's about who you know. And so that's one of the biggest things I want to push for this year coming up.
That sounds great. I do want to backtrack a little bit. How did you get here? You started out in nursing?
I am a nurse by trade. I've been a nurse for 18 years. I've started in nursing. We've worked the hospital, acute care settings, ERs, and things like that. But it was a vision God put on my heart to do in-home care. It just came out of nowhere. I was sitting in church. It says, do in-home care. So, what does that mean? So, literally got into it 2 feet, dived in, and then my motto is just do it. Nike sign. So anything I do now, don't talk about it, just do it. And that's what I've been doing all these years. And so we started in my home, and then eventually we grew fast. In a month or two, we had to get a little office space. And so we grew from that office space. But one of the reasons why we opened up our second business was because we saw a lot of our in-home patients, they in the home, eventually they couldn't stay there, and they had to go to a nursing home and eventually died. So that was a passion of us. We said, well, we have to do something about this. So we thought of the mini homes, so our goal is to have a lot of little mini homes throughout the Kansas City area. So our first one is 10 beds, like I said, but maybe next time will be a little smaller. And so it'll be more of a one-on-one contact versus 30 to 1 patient in the nursing home.
So you want that more intimate care. I
Yes.
see.
Mhm.
Is that a novel idea, having the mini homes versus
It
the
is.
nursing home?
Yes, it is, especially in Kansas. They are really big on, they call them Home Plus, and that's the term in Kansas. Now in Missouri, it's not so much of that going on because, again, a lot of times people are looking for the bigger profit. Again, it's not about the bigger profit, it's more of the care for us, individuals receiving that one-on-one care, and they know they're like our family, so, and that's our mission for that piece of what we do, so.
Well, it sounds like you're so busy. How do you manage to integrate your personal life and your business life? When you say we, is this your family? Was your family involved with this?
Actually, my husband's a big support. He's always there. He gives me advice, and so he's very wise, I say. And so I listen, especially when dealing with people, and that's been a challenge because you have to learn everyone's personality and form a little bit to that personality. And so, but as far as my business life and home life, and that's another thing that we learned at the program with Babson, is we have to know when you have to have a work-life balance. And at that time, and still I'm working at that very, very hard, there's no homework balance because I'm always working. And so since then I've worked a lot on putting home where home is and business where business is, and some days I do still cross over because it's just a challenge for me. And so that's a thing I'm working with. It's a me piece there. But that's definitely difficult because I do have 3 children and I'm almost in school right now, and so now I have to manage my time very wisely.
I know I hear about some entrepreneurs there going away from being a workaholic, and they're making sure that they turn off their phones after 7, and do certain things to keep those boundaries in place. And like you say, it's not always easy. Even here, I find myself, okay, can I really put the phone down? Some days I can, and some days you just can't.
You can't, yeah.
Right. Well, is there if we wanted to get in touch with you, the community that sees you here today, how would they get in touch with you?
Well, we are located on 63rd Street. Our address is 305 East 63rd Street, and that's right there in the heart of Kansas City towards the Brookside area. And our phone number is 816-756-0405. And we also have a business cell that is 24 hours accessible, but whether you call the main line, but it's 816-678-8061. And feel free to come by and see our facility. Our 10-bed is just marvelous. We love it. It's like a little mini home. And so that is one of our things we're proud of.
Do you guys have a website, or do you need one right now?
We do have a website. Again, that's blesshealthkc.com. It's our website.
Okay.
Yes.
Well, you've heard it here today from Musadine Harold, Kansas City. You always need to tune in to find out what's happening in Kansas City here on What's Up KC. You can also tune in to CascadeSports.tv. And this is Michael. And make sure you clean up your own house first before you get out and try to do anything else. Thanks for joining us.